Medical real estate expertise for powerful locations and better healthcare deliveries. Showcasing standalone emergency departments. Flagler Investment Realty unique capabilities can empower medical centers and hospitals in acquiring new patients and dominate the marketplace. Flagler Investment has developed a specific access point program using a comprehensive knowledge-based real estate strategy to identify and secure optimal access point locations throughout the acuteness of care. From hospital-based doctors' offices, medical spas, urgent care centers, to standalone emergency departments. Emergency rooms and, for lesser acuity, urgent care centers are great tools for large medical centers and medical organizations to compete in the marketplace. Emergency rooms are equipped to handle life and death matters like traumatic injuries, heart attacks, and anything less severe. The use of emergency rooms nationwide has increased 30% since 1997 to about 129 million patients, or an average 42 visits per 100 persons in the U.S. in 2012. 13% of these ER visits resulted in hospital admissions. Traditional emergency departments located on hospital campuses face increasing structural and operational problems. Wait times jumped 25% to 58.1 minutes from 2003 to 2009. Crowding grew even more rapidly, mostly due to diagnostic tests and treatment intensity. Also, and despite the Affordable Care Act, the nationwide shortage of primary care doctors will make it difficult for many of the newly insured to find a personal physician and might end up in the ERs. Hospitals are very expensive to set up and to operate, therefore limiting the number of these access points within the community. Freestanding, no-wait emergency centers are cropping up in fast-growing suburbs, providing closer-to-home options to those often dreaded crowded ER waiting rooms in urban hospitals. It's an efficient way for hospitals to meet growing emergency care needs of the communities and increase their respective patient space. The focus, treating people where they live and work and getting them through the system and to a doctor quickly and in the most cost-efficient manner. To demonstrate how we can help your organization, let's consider a fictional case of a hospital willing to set up a standalone emergency department in a 10-mile radius around the city of Palm Beach Garden in Palm Beach County, Florida. Locating the optimal property requires a medical microanalysis at the zip code level. We analyze the medical demand, including demographics, psychographics, and the payer mix, as well as the medical supply, competition, mix, medical gaps, and clusters. We then systematically assess each real estate asset within this area using such criteria as accessibility, visibility, or medical tenant mix. With this data, we built use rates for every age, gender cohort for every zip code. We apply this use rate against the population for the age, gender cohort. We can then predict the market for the CPT codes. We also look at demographics and economics, and in particular, median household income data, median household wealth, current population, projected population, gender. We can locate facilities across the continuum of care: urgent care centers, standalone ER, acute care hospitals, rehab, psych, senior housing, medical office buildings broken up by how many doctors are in this facility. We also know where primary care physicians and specialty physicians are located in the marketplace and export their contact information for future use. We can determine the current and projected need for additional physicians. For example, using the average of 4,100 encounters yearly for family practices, and given the demographics, we can determine a need for an additional general practice in the area. Now, to assess the demand for emergency rooms, we use CPT codes from 99281, minor severity, to 99282, immediate threat. We can therefore see which areas generate the largest number of visits. Our strength is to cross-reference hundreds of data, In this case, we developed a weighted average methodology that compiles both demographic and medical information. This system analyzes all the zip codes in the country and provides thermal maps with national, state, and market percentile. Palm Beach Gardens ranks the highest in the 97th percentile nationally. This information is then cross-referenced with our real estate databases to identify the best locations. For the specific example of standalone emergency rooms, we focus on properties offering the maximum visibility, average daily traffic, and setback from the thoroughfare, preferably located in retail centers with more than 70,000 square feet of leasable space with the right tenant mix, and offering at least 9,000 square feet within end caps or on out parcels with the right zoning and use and set up in a way that ambulance drop-off is convenient. We then provide a comparison showing all these criteria, as well as detailed presentation of each one of these options. Option K, for example, is a 100,000 square foot mall anchored by Michaels and Staples with a wide frontage on Okeechobee Boulevard. The end cap offers 10,000 square feet of leasable space and is convenient for an ambulance drop-off. The center allows for non-stop operations 24/7, and zoning allows for medical centers. Also, the location being farther than 250 feet from a residential area, no public hearing will be necessary to open such a center. The building is a shell that will require about $100 per square foot to set up the necessary rooms for exam, CT, medication, lab, decontamination, trauma, etc. We have only touched here upon some of our capabilities and would love the opportunity to work with your group. Over the past few years, Flagler's unique expertise has been called on by leading organizations such as Tenet, Memorial Hospitals, HCA, or Bethesda Health, among many others.